Hi, my name is Melissa, and this is my presentation on chronic obstructive pulmonary disease, also known as COPD. What is COPD? COPD is a group of conditions characterized by obstructed airflow. Signs of it are chronic bronchitis and emphysema. These result the inflammation of the airways result in destruction of functional lung tissue, hyperinflation, increased mucus production. The airways become narrowed, which leads to obstruction of airflow. There are 4 stages of COPD, and these are based on the Global Initiative on Obstructive Lung Disease. So there's mild, moderate, severe, and very severe COPD. For the history of COPD, symptoms have been around for 200 years. In 1679, Theophile Bonnet referred to it as voluminous lungs. In 1769, Giovanni Morgani referred to it as turgid lungs. In 1814, Charles Badham identified chronic bronchitis as a disabling health condition and part of COPD. He was the first person to use the term catarrh for it. In 1959, the SIVA Guest Symposium helped define the components of COPD. And in 1965, Dr. William Briscoe gave the disease the term chronic obstructive pulmonary disorder. For my etiology of COPD, over time, exposures to lung irritants such as smoke or chemicals can cause damage to the lungs and airways. The leading cause of COPD is smoking. So for smoking, 75% of people develop this. Chemicals in cigarette smoke weakens the lungs' defense against infections, it narrows airway passages, and causes swelling in air tubes and destroys air sacs. Other tobacco products besides cigarettes are e-cigarette and cigars. Occupational exposure on COPD is ongoing and long-term exposures to chemicals, dust, and fumes. 10 to 20% of respiratory symptoms of lung function impairment. Air pollution and COPD, long-term exposure to particulate matter 2.5 and nitrogen dioxide. PM 2.5 comes from motor vehicles, factories, power plants, wood burning, and wildfires. And alpha-1 antitrypsin deficiency, also AATD, is a genetic or inherited condition that affects the body's ability to produce alpha-1 protein that protects the lungs. It's most common genetic form of emphysema. For diagnosis of COPD, it goes unrecognized for years. People seek health advice when shortness of breath occurs. About 50% of lung function may be lost. Pulmonary function tests are used to detect irregularities in pulmonary function and to determine the degree or impairment. So they assess in pulmonary function tests, the lungs are assessed, assess the volume of air that an individual can take in and expel from the lungs, as well as the ability to move air into and out of the lungs. They use a spirometer, which measures several types of pulmonary functions, and it assesses various aspects of airflow. So the type of pulmonary function that are measured in the terms of lung capacity are vital capacity, forced expiratory volume, residual volume, maximum voluntary ventilation, MVV, tidal volume, inspiratory capacity, functional residual capacity. So this photo is just a picture of the pulmonary volumes from the textbook, and this is the lungs and COPD. So how COPD affects the lungs. For manifestations of COPD, you have chronic bronchitis. So it's a chronic cough with sputum and abnormal enlargement of the mucus glands within the airways. Signs and symptoms of chronic bronchitis are persistent cough, excessive volume of mucus, and expectoration. Emphysema is another manifestation, and that is the permanent enlargement of the alveoli caused by overinflation and destructive changes in the alveolar walls. So the alveoli have less surface area available for exchange of oxygen and carbon dioxide, and bronchioles close before exhalation is complete. Airways become obstructed, stale air, which is high in carbon dioxide and low in oxygen, becomes trapped in the alveoli. The lungs become hyperinflated. Advanced COPD is another manifestation. So what occurs in advanced COPD is hypoxemia, which is a decreased levels of oxygen in the blood, impaired judgment, confusion, motor coordination, hypercapnia, inadequate gas exchange in the lungs. Oh, so drowsiness, increased difficulty expectorating secretions, increased shortness of breath, increased vulnerability to pulmonary infection. For treatment of COPD, the treatment goals are to relieve manifestations, improve health status, improve functional capacity, and reduce chances of complications. There's no cure for COPD, but there are methods to slow progressions, which will be talked about in this. So smoking and cessation and lifestyle modification. So what you can do for this is behavioral techniques, support groups, nicotine supplements, medications, exercise, build up your strength and endurance, maintain your physical condition, and consume small meals rather than large meals, which this may facilitate breathing better. For medications, bronchodilators are used. Vaccinations, so those who are susceptible to pulmonary infections and pneumonia are recommended to get vaccinations for it. Breathing techniques, diaphragmatic breathing, which is reduced use of accessory muscles for breathing and to conserve energy. Pursed lip breathing, which is slow breathing rate and help remove trapped air from the lungs. And resistive breathing device, which exercises muscles of respiration. So here on the right is a photo of resistive breathing device. Oxygen as a treatment, so effects of COPD related to oxygen, the right ventricular failure, polycythemia, severe shortness of breath, and sleep-associated hypoxemia. Oxygen administration during ambulation can reduce the effects of dyspnea and increase endurance and the ability to carry out daily activities. So there are two types of oxygen machines. There's a stationary oxygen system that needs to be plugged into the wall, and a portable oxygen system that can be taken around with the individual. Surgical interventions can occur. So lung volume reduction surgery, this improves pulmonary muscle function and exercise tolerance. Lung transplantation, individuals that experience severe incapacitation as a result of COPD. Pulmonary rehabilitation is another treatment. Individual multidisciplinary program composed of breathing exercises, physical conditioning, energy conservation, physiotherapy, education, and nutritional, psychological, behavioral, and vocational intervention. For prognosis of COPD, life expectancy varies with each individual diagnosed with COPD. It depends on their symptoms, age, health, severity of COPD, and if they're a smoker or a non-smoker. COPD is not a terminal illness, but progression worsens over time. If an individual is diagnosed early, has mild stage COPD, and disease is well managed and controlled, the individual may be able to live for 10 to 20 years after being diagnosed. The life expectancy is shorter for those who are smokers. Individuals with severe stage of COPD lose around 8 to 9 years of their expected life. Simple lifestyle changes can help an individual maintain a good quality of life, such as healthy weight loss, balanced nutrition, and exercise. Contraindications for COPD are medications such as beta blockers, NSAIDs, opioid analgesics, sedatives, and muscle relaxants, general anesthetics, and antibiotics. Treatments that can also contradict with COPD are high-dose oxygen therapy. So this can suppress respiratory drive and cause elevated carbon dioxide levels in individuals. Management plans that are functional, activities and participation. Individuals may find themselves excluded from activities due to limitation of their condition. Exercise programs can help with this, so they boost self-esteem and reduce manifestations to some extent. Individuals can learn to get accustomed to some dyspnea and adapt to the sensation. This helps prevent anxiety from occurring. It's best to divide activities into smaller tasks rather than trying to accomplish everything at once. Home and work temperature should be kept at a cool temperature. This will minimize mold growth and avoid sources of air pollution in the home. Activities and participation continuation. So maintaining adequate hydration. Hydrating yourself thins out the mucus. Responses from family and friends of the individuals to help them cope with the condition. Lifestyle changes, cessation of smoking, counseling and support groups. How it affects sexuality is that sexual difficulties due to fear of shortness of breath may occur. They have fear of suffocation. Tolerance for sexual activity can be increased through conditioning, and it's best to speak with their partner regarding concerns. Vocational management plans. So energy conservation techniques, plan activities and pace to improve performance within limitations. Stress management. So this means to reduce stress-provoking situations. Sit to do work rather than standing, since this requires less energy. Eliminate unnecessary motion or movements. Prioritize tasks. Transportation. So this means to drive less congested routes compared to high traffic areas. Allergen-free work environments, such as free of dust, fumes, and chemicals. For psychosocial management plans, shortness of breath will lead to anxiety, which leads to avoidance of activities that cause shortness of breath. So education and support can be found, counseling and therapy. This addresses anxiety, depression, stress management, and coping. Stress management techniques, such as deep breathing exercises, behavioral interventions. So these deal with smoking cessation, medication adherence, physical activity, and dietary change. Another is pulmonary rehabilitation. So in my conclusion, COPD is a disease that is a group of conditions characterized by obstructive airflow. COPD causes destruction of functional lung tissue, hyperinflation, increased mucus production, and it leads to airways becoming narrowed. This can occur through smoking, occupational exposure, air pollution, and alpha-1 antitrypsin deficiency. It goes unrecognized for years. There's no cure for COPD, however, treatments can delay progression of it, and depending on an individual's lifestyle and the stage of their COPD, they may live up to 10, 20 years after their diagnosis. This is my references. Thank you very much.